Perfect. So welcome to our training, everyone, Fighting for Air, our ETO public commenting training. My name is Erin Miss Jones, and I am the Tennessee EJ organizer with Young Gifted and Green. And today we will help you prepare to submit a powerful public comment before the May 1st deadline. And Kishan, do you want to jump in and introduce yourself?
Yes, my name is Keyshawn Pearson. I'm the executive director for Memphis Community Against Pollution, and we fight for environmental justice and climate justice all throughout Memphis, and especially focused on Southwest Memphis. And so we've been fighting for ethylene oxide changes as far as the EPA's rule, and we were successful. This happened back in 2024. And so now that rule isn't being threatened to be rolled back. And so we want you all to be equipped to send public comments to help keep that rule and keep those rules that we've changed in place.
Thank you, Kishan. All right, so today we'll have approximately an hour that we're going to cover, just giving you all a brief overview of what our agenda will look like today. So we've already done our welcome introductions. We will cover briefly what is ETO, the health impacts, and who is most impacted in our community, the 2026 proposed rule and what's potentially at stake, what makes a great public comment. So we'll provide some tips and a rubric on how to draft your own public comment. We will spend some time analyzing and reviewing a real public comment. We'll do a mini writing workshop as you all work together to draft your comment, and we'll provide some feedback. And then we'll also provide the steps on how to submit your comment to regulations.gov. And then at the end, any questions that you all have, please drop them in the chat as we are going through the presentation, and we'll answer it at the end of our presentation. All right. Okay. And so by the end of this workshop, we hope that you will understand what ETO is, again, who it harms, what's being rolled back, and exactly how to submit your comment before the May 1st deadline. In addition to that, we want to help you all to ensure that you know how to draft a clear public comments with a problem and a solution statement within your public comments. And again, any other questions that you may have, making sure that we answer them clearly for you at the end of the workshop. All right. So what is ETO? ETO is a colorless, odorless gas used to sterilize medical devices, surgical tools, and some food products like nuts or spices. You can't see it or smell it. It is extremely harmful as it causes or can cause breast cancer, lymphoma, and leukemia. And in 2016, the EPA found that it is 30 times more toxic to adults and 60 times more toxic to children than previously known. Keyshawn, did you want to add anything to that?
So in the city of Memphis, in Southwest Memphis specifically, our facility was ethylene oxide, and they had been emitting ethylene oxide at extreme levels since the 1970s. And so what we learned was that in addition to understanding that it is carcinogenic and it already was terrible for our environment, it was still classified a lot lower than it should have been. And so, as bad as the pollution was initially, it is actually even worse. And so, we live in what the ramifications of that are because we have elevated cancer levels in the area adjacent to and the entire area that is in the radius of where sterilization services Tennessee was. Now, I do got to say, we were successful in getting sterilization services Tennessee out of here. And so they are gone. But this rule is to protect all folks around the country who have been and are going through what we're going through in Southwest Memphis. And so we still need this rule in place, even though at this time it's not affecting us more directly, but it is still targeted to areas that have high Black populations and high marginalized communities.
Thank you, Keyshawn. So, looking at those high risk communities and marginalized communities, who are our folks that's most at risk? Pregnant people and children face the highest risk. ETO crosses the placenta, and children breathe in more air per body weight and can't clear ETO as quickly as adults can in their bodies. So, there is no safe level of ETO during pregnancy, and over 1.25 million children currently face an elevated cancer risk from ETO alone. When we look at, the communities that are most impacted by this, as Keyshawn shared, it's often marginalized communities where we see this pollution happening. And those people that also work in these facilities are at, high risk of being impacted as well. Um, when we talk about the communities that are impacted again, we have schools that are usually within a mile radius of some sterilization facilities. And mothers in the communities often ask, is it safe to be present here? And that question should never be asked. When we look at the cumulative impacts and environmental justice impacts or issues, cumulative impacts means that the total pollution burden a community carries is not just one of the chemical burden, but it's all the combined impacts that happens in this community or happens to this community. ETO facilities are disproportionately sited in low-income communities and communities of color. When we talk about fence line communities, commercial sterilizers are disproportionately located in these communities, and they already bear high power pollution burdens from traffic. A lot of times we'll see expressways or just high traffic areas with some of these communities, high other industrial facilities that may be polluting these areas, and other sources. When we talk about the stacking effect, so ETO does not exist in a vacuum. Communities like Memphis, such as the 38109 zip code, faces a cancer risk 4.1 times the national average. And ETO is only one piece of a much larger puzzle of the overlapping exposures that folks in South Memphis are faced with. When we talk about the health inequalities, residents in a lot of these communities are already dealing with chronic health conditions such as asthma, cardiovascular disease, diabetes, and so they face an even greater harm when they're exposed to carcinogens like ETO. And their bodies have a less capacity to absorb these additional toxic burdens. And finally, when we talk about the environmental justice impacts, when regulators roll back these protections, communities of color pay the highest price and the highest burden. So strengthening this rule is an environmental justice issue, and silence is not an option. Kishan, did you want to add anything to that?
Yes. And truthfully, the only addition that I would add is that these communities have a legacy of being extracted from. And what Aramis mentioned about comorbidities is because of that legacy of pollution. In Southwest Memphis, we have the Valero Oil Refinery, we have the Nucor Steel Mill, we also have the Tennessee Valley Authority's combined cycle plant, but it used to be a coal plant, right? And so these legacy polluters also have contributed to the health impacts that folks carry, and sterilizers only exacerbate the health injustice and the health issues that people are already challenged with. And so when we think about fugitive emissions, which is the real focus of this legislation, and what we have to pay attention to is the fugitive emissions, the emissions that are never supposed to come into contact with human beings, that is considerably being increased in the areas around sterilizers, but they're also intersecting with a lot of other pollution from a lot of other bad actors. And that's what makes it an environmental justice issue, what makes it a health issue, and why we have to also consider the legacy as well as the cumulative impact of all of the pollution in these areas.
Perfect. Thank you. So let's examine the 2026 proposed rule and talk about what's at stake. So the 2024 rule would have cut ETO emissions by 90%. The current administration is proposing to undo nearly all of it with four key rollbacks. Those key rollbacks are: one, eliminates all health-based cancer risk standards; two, removes permanent total enclosure requirements, meaning invisible leaks go uncontrolled; three, It makes continuous emission monitoring optional, and the community loses real-time data. And four, it weakens the aeration room vent controls for the new facilities. So these are the potential rollbacks of this new EPA rule. And Keyshawn, did you want to add anything to what's at stake here?
Yeah. So what I will say is that what's at stake is everything we fought for, right?
Mhm.
We fought for these rules. We fought for the ability to really maintain and contain the amount of fugitive emissions, which makes everybody safer, right? It makes the employees safer. It also makes our community safer because these emissions aren't seeping out into our environment where our children are, where our families are, where our pregnant mothers are. And so everything that we fought for, everything that folks have unfortunately literally died for. Both of my grandmothers passed away from cancers. My uncle, they didn't even have a name for the affliction that he had because of his intersectionality with the pollution. And so, what's at stake, truthfully, is the future longevity of our communities. Mallory Heights has the lowest life expectancy in the state of Tennessee. This is where sterilization services of Tennessee was. And so these things are not just correlated, you can directly see the cause and effect. And so when we think about what's at stake, we see the numbers, right? We see the levels of fugitive emissions, but it's also a human impact that's also at stake at the same time. Thank you, Rich.
Really? Yes. So if we look at the what's at stake and we talk about it by the numbers, this is the cost of rolling things back. So 7.8 tons of additional ETO emissions per 85,000 plus more people above EPA's own acceptable cancer risk benchmark. So what this will, I'm sorry, I'm jumping on. So that's the first thing is 7.8 tons of the emissions, additional emissions. Then we'll see 85,000 more people exposed to cancer risk above the EPA's accessible threshold. We'll also see 38 million plus more people exposed to greater than 1 in 1 million cancer risk. We will see 6,000 in 1 million maximum individual cancer risk under the proposed rule. So that's 60 times the EPA's own acceptable limit. We'll see 14 more million more Americans will live within that 5 mile radius of the commercial sterilized facility, and 0.002 cost savings per sterilized medical device, just 2/10 of 1 cent. The only benefit is what EPA has calculated. So as we're looking at these numbers, as Keyshawn was, previously sharing, there is nothing but a cost of of health and well-being and life that's at risk. There are no, human or community benefits that come out of rolling these things back. This is just additional harm that will happen to communities that are already and have already been impacted by environmental harms. Anything that you would like to add to the numbers, Keyshawn?
Yeah, no, these numbers are perfect, and I think it shows what the scope is. And again, the thing that I don't want to be ignored is the fact that this also contributes to an even higher elevated cancer risk. And so while we know for a fact in Shelby County and Memphis and Southwest Memphis specifically, we have 4.1 times the national average, right? What we what we can confirm, right, based on these numbers, is that would basically increase instead of decreasing for communities all around the country. And so that it also increases the body burden, but it also increases a financial burden on these communities because if someone gets cancer, it's not just individualized. Most oftentimes, those cost of time, that cost financially, also ripples into their families and their communities. And so we have to continue to think about this holistically as our entire community is going to be affected by this and be harmed by these rollbacks.
Absolutely. And I think about it even from like a, systemic standpoint where when you think about people dealing and living with chronic health conditions, you think about the long-term impacts that it puts on our healthcare system, our school system, all of those, all of those things that, make life or make a life worth living, and it's all going to be impacted long term. So it's not just this is only happening in environment, like this is happening generationally to the people that are living in or near, these sterilization centers. So, all right, let's jump back. Okay. So now that we all have the facts and the detailed information about ETO, now we can start the process of understanding some tips that can help you all make a great public comment. So we have 5 steps from our public commenting cheat sheet that will hopefully help you putting your comment together and make your voice count. All right. So locate the rules to sign up. So research the rules for sign up, whether in person or written. So for this particular rule, and we'll provide this to you all that have signed up, you will go to regulations.gov and search the docket, which is EPA-HQ-OAR-2019-0178. Once you've located the rule, you will now research the topic. So cite some reputable sources like the EPA data, peer-reviewed studies, and community health reports to strengthen your comment. And we also have those resources on our website, and we can provide them directly to you via email. And be concise and straightforward in your comment. So get to the point. For written comments, summarize each point with no more than 2 sentences. You don't need a law degree. Your lived experience matters. Telling, your story and the impact that it will have on your life or the impact that it's already had is compelling enough. And then meet the deadline. So the deadline for this particular comment is May 1st, 2026. Late comments will not be considered. So don't wait and submit early bird, and then share it with your network. After submitting the comment, galvanize and bring others, into the mix by sharing it on social media, texting your friends, texting, if you have a good relationship with, your coworkers, like let them know about this, contact your elected officials. Every single comment counts to show that, this is something that community is not wanting to happen because of the harms that it's going to cause. So these are the tips for making a great comment. And no, don't let perfectionism stop you. Again, more heartfelt, more of you telling, your story and the impact is going to go a long way with this comment. All right. So a public comments rubric. So a strong public comment meets all 4 of these categories, and you can use this rubric to assess any comment, including your own. So those 4 categories are: is your comment clearly stated and articulating the problem? Does it specify the policy or legislation, etc.? Does it identify or name the impacted stakeholders? And 4, does it provide solutions and recommendations? A strong comment works to meet all 4 of these categories. All right, Keyshawn, I'll let you take this part.
All right. So I think always the best way to really start is to see an example. That's how my brain works. And so here's a sample public comment. I am Keyshawn Pearson, the leader of Memphis Community Against Pollution. In 2022, EPA representatives confirmed that ETO was 60 times more dangerous than previously understood. In zip code 38109, we have a cancer rate 4.1 times the national average. We have watched our families deteriorate and die due to cancer and illnesses we have no names for. Our community demands that the previous updated and strengthened provisions remain. And so we'll open up the floor to have folks analyze this comment. And don't be shy to critique, for real. It's just an example. Question 1, do y'all think this meets partially? Does it meet it, or does it just not meet the rubric categories that we listed in the last slide.
Yep. And if you
And
all need me to slide back to the rubric, I can.
oh yeah, I think that's a good idea.
Okay. Let me go get. All right.
Come on, somebody, you can just come off mute, I think. Is that
Yeah,
right?
you can come off mute. Like I can't see you guys, so please take yourselves off mute.
Somebody, anybody. Okay. Well, I would
Okay,
say,
we have a shy crowd today. Okay.
right, right. I would say, I guess, oh, they don't have access to unmute. Okay.
Oh no. Okay, sorry. Give me just a second. Thought you did. Okay, panelist attendees. Allow attendees. Okay, try now. Can you guys unmute yourselves? Okay. I'm having technical difficulties on my side. I thought I unmuted y'all. Okay. Well, can someone raise their hand and then I'll unmute you?
I was seeing if the question is, did the comment, the example comment, meet the criteria on this rubric? And if so, how or how not, if it didn't?
Mm-hmm. I'll unmute you, Josh.
Am I unmuted? Hello?
Yes,
Yep.
you are. Mm-hmm. And then you
Okay,
muted yourself.
awesome.
There you go.
Okay.
Mm-hmm.
All righty. Could you go back to the comment? Could you
There
go
you
back
go.
to the you took some what I just yeah, that's great. Okay, now I can answer it. I feel like now. Remain. All right. Okay. So now I can look at the rubric if you want to go back forward.
There we go. And so the question is, does this comment meet the categories?
Okay. I do think it clearly stated the issue, articulated the problem. He did say that he wanted um the rule to stay in place. Um he identified some who was at stake. I'm trying to see it was a policy was specifies the policy legislation. I think that was in there, provides solution and recommendations. Yeah, I don't know. I feel like maybe the solution and recommendation was basically just for it to stay, but maybe it could have been a little bit more there.
Let's go back and see.
Yeah, because it just says our community demands that the previous update and strengthened provisions remain due to the council illness. Oh yeah, okay, that's right. Well, you know what? It has some data in there as well. I mean, it's pretty strong. As I look at it, yeah, that's pretty strong.
Okay.
Stands ago, we had cancer rate, yeah. Um, I guess I don't see I don't know how specific we want to be when it comes to like the policy and all of that. Uh, so I guess if you can give clarification on that part about the policy when you say on the rubric, does it address the policy or states it or something? Like, I don't know
Mhm.
how specific we want to be with that.
Yeah, that's a good point. Um, so I think, depending upon, how, as far as like what how you're telling, I guess, like your impact or your story, like with this particular statement, like he gets pretty much straight to the impact and what it described, like what the policy, what the 2022 representatives, like what they confirmed to be 60 times more dangerous. He doesn't have it too much in here. So what I would recommend to Keyshawn is say, hey, this particular legislation, states this and this, which, will be harmful in this zip code, with the cancer rate already experiencing this national average. So I would say, maybe add that, just maybe like a little smidget from what the rollback would, what the legislation would state as far as like the rollback or the changes that it's going to make. Keyshawn, what do you think? But I'm like, in my opinion, I don't think you would
Okay.
need to get too detailed because, again, we're not expecting you all to, be attorneys and, break down the new legislation in too much detail.
Yeah, I think the one thing that I would just basically compliment what you and Josh were saying, by saying that I don't necessarily think you need to be able to name the legislation by its specific government name, quote unquote. But I think in this example, we could have said, even if it was in the next steps, like our community demands that the previous updated and strengthened provisions in the 2024 EPA rule remain, just something that makes it a little bit more specific than generic around ETO, because it's been, iterations throughout time. So it's just like, let me give you a specific, we're talking about this specific set of provisions that we want to stay there. So I think even just giving it the date of like in 2024, excuse me, I think that would be helpful to make it stronger.
Cool.
Thank you.
Does anybody want to share what they believe is the strongest element of this comment or what can be strengthened? I think we already kind of touched that, but was there anything else that anyone else recognized? Like I said, just raise your hand and I'll take you off mute. Let's see. All right, Ashley. I got you, Ashley. Here I come. There you go. And you can take yourself off mute.
Oh, hi.
Hi.
I think the clearest part or the most compelling part was the demand. I think um the brief did a great job of outlining the problem, but the demand of what they wanted just to keep the provisions as they are was really clear.
Okay. Good feedback. Okay. And would anyone like to share what they would add to make this comment even more powerful? Keep clicking off of there. No addition. I think Keyshawn had already given y'all the answer. All right, y'all. So we're gonna move forward. Thank you all for participating in the discussion. Okay. And so here is how if we were working together in a group, in doing our comments, this is the feedback that we would provide to Keyshawn. We would say, yes, you clearly stated the problem. yes, you specified the legislation. You do reference the updated provisions and demands that they remain. And then, yes, you identified the impacted folks in community. So that's our community, that's our families, that's zip code in 38109. And then partially, we talked about the recommendations or the solutions. So this comment demands that the 2024 provision remains, but it could be strengthened by naming specific provisions such as the CEMS requirement, PTE, or health-based standards, and what EPA should do differently. All right. Okay. So now we will do a mini practice session with one another. And so in this mini writing workshop, your comment does not need to be long. This can just be your draft to just kind of get you started in this process. And so even 3 to 5 sentences can definitely make a real impact in your commenting. And so let's start with the two most important parts when it comes to commenting. And we'll spend about like 5 to 8 minutes on this process. And so part one, what we want to do is state the problem, your problem statement. So within this, we want to identify, like Keyshawn did, who you are, your name, your role, the community that you represent, where do you live, why do you care, what is the specific problem, who is being harmed, what rule or policy are you commenting on? And so that's part one. And then part two is solution. So we want to answer the questions of what do we want EPA to do? What specific positions must be kept? What would happen without those protections? What does your community deserve? And any personal story or data to support your solution. Okay. And Keyshawn, did you want to add anything to that?
I think no, those are great. I think you just want to lead with something that's personal to you. Doesn't have to be like personally identifiable information, like your address, but just whatever illustrates like your personal connection.
Okay. So I will pop a timer on, and we have this template here for you all as well. I'll pop a timer on and give you all about 5 minutes to come up with your problem statement / starter and your solution statement. All right. So let me see. Current time is 3:36, and I will check back in with you all. Do y'all need 5 minutes? Or I give y'all 4 minutes. I give y'all 5 minutes. I'll check back in at 3:41. All right. Go and be great. See y'all in 5. All right, got one more minute, everyone. All right. Okay. How's everyone feeling about where they are with their statement so far? Their draft statement. Anybody want to jump out there and share? All right. Ashley, is it okay if I read yours?
Sure.
All right. So Ashley submitted, hello, my name is Ashley and I am a resident in Midtown. I am writing to oppose the EPA's 2026 proposed rollback of the commercial sterilization national emission standards. Our community is already facing lead in our service pipes and that essentially poison our drinking, well, essentially poison our drinking water, but there is no clear timeline in place to replace these pipes. Reducing protections from ethylene oxide, a known carcinogen, would only intensify the burden and further place families at a greater risk. We deserve a safety inside and outside of our homes. Okay, it's a solid start. Okay, so let's go back to see if I can slide back to our rubric. Anybody want to provide feedback on Ashley's statement?
This is Keyshawn.
Yeah.
Ashley, I think this is great. I like that you put the EPA's 2026 proposed rollback. Um, is That's incredible. And then the addition, like the intensifying the burden, I think is very strong.
Thank you, Ashley.
Mhm.
Anyone else want to share? All right.
Do you think it'll be stronger if I like had like specific numbers and stuff in there of how many lead service pipes are there, or is it better to not have like so many numbers and stuff in the problem statement?
This is Keyshawn. I'm gonna just go out and say, because the focus is on ethylene oxide, I think having data around ETL would be stronger. Um, and to show, that that combination could be significantly more dangerous.
Okay, that's good.
But again, I think illuminating like the comorbidities due
Mm-hmm.
to like having such a high pollution burden is something that is significant. But the having data, having numbers that are backed by research is always helpful to make a stronger case for what you want to happen. A lot of times people criticize us saying, y'all just keep making speeches, but it's like our speeches also include real data and real lived information. Like
Yeah.
there is lived education, right? That also matters.
Yeah, those are good points, Keyshawn. I think um, what Keyshawn said about, recognizing the impact of, um, yeah, the lead pipes, and, our, water, being at risk when it comes to the residents being exposed in these communities. Like that's, just one other thing that our communities are already facing. But yeah, if you wanted to, make the comment, stronger around specifically what has happened in the community already with ETO and how, this community has already been impacted by, the sterilization center that was in our neighborhood. Um, and in addition to that, they face these other burdens. Like this would only, you know, continuously add to all of the other environmental injustices that they face. In some way, kind of formulated it like that. I think just to kind of show like these are all of these like compounding factors that people are already facing. Like let's not add, one other thing onto the communities that are dealing with, these other chronic health conditions because of the environmental harms that have already been done. But I think you have a really good start, Ashley. All right.
Last thing I'm gonna
I
add real
agree.
quick.
Oh,
Yeah.
Who's oh my bad. Who's that?
It's
Josh, go
Josh.
ahead.
Yeah.
oh no, I think it's good. I think she kind of hit all the points there. Into the burning fight place of great rest, we have safety inside out. Yep, yep. I think it's pretty solid.
Awesome. Only thing that I would add is like I read the I oppose, so it gives your position, and then I think the only thing that can make it stronger is like to provide solutions or recommendations. So I think just stating that, the resolution or the recommendation is that the EPA, doesn't roll back or that the EPA, sticks to, but, I know these things can be super long, but I think one thing is saying you oppose is like, I think sometimes they can like frame it as being personal.
Hmm.
But giving them a recommendation as like, yes, I oppose this, and I'm also recommending
Mm-hmm.
that you know, keep the provisions. And to what Aramis and Josh was saying about my comment, that we recommend that you keep the provisions as it pertains to permanent, I forget, what was it, PTD?
Hmm.
Mm-hmm.
Since Keyshawn, since it can't be too, I mean, what do we suggest since it can't be too long? Because I guess I'm not sure how long can a comment be if it's a
Yeah.
written comment. I know it's time comments when we do public speaking comments, but
Hmm.
written comment, what's the rule about how lengthy it should be?
So oddly, I've actually only seen like where it's like 1,000 words or something. I think I've seen that like once
Okay.
or twice where they will give you like a word count limit. But we've seen comments from our lawyers, like the Southern Environmental Law Center, that are multiple pages long, right? Where they go into really technical details. But I think as just like a rule for individuals who aren't compiling so much information, so much data, that anywhere from 1 to 2 paragraphs is like where I would probably kind of max out 1 to 2 paragraphs.
Mm-hmm.
Gotcha.
So if you want to stay, if for Ashley's instance, like if you want to stay, I would kind of, just do a little bit of like maybe reducing one sentence and then changing it with another or something like that. But yeah, my recommendation is 1 to 2 paragraphs at the most.
Gotcha. Wait a minute.
It's a good question, Josh.
I kind of made up one. If you all want me to read it, it's only if you all would like to hear
Yes, we
Yeah, we
would.
would.
it. Okay. Here we go. I kind of wrote it down in my group. Here we go. My name is Joshua Perkins, and I'm a resident of Evergreen, located in 38104, Memphis, Tennessee. I'm writing to oppose the EPA's proposed rollback of the commercial sterilizer national emission standards. Historically, black overburdened communities are facing high cancer rates and other health issues due to all the emissions and toxins polluting our neighborhoods. I demand we keep the rules established in 2024 in place. I also will pose a question: what would you do if it was your community? We all deserve a safe, clean, and healthy neighborhood for our children to grow up, for our children's children to grow up in. And I kind
That,
of just leave it there.
that
Yeah,
sound that sound solid to me.
yeah. You clearly stated the problem. You specified the policy. You identified those in community that were impacted presently and in the future, and provided solutions, recommendation.
Boom. And like Ashley said in the chat, the rhetorical question is
Mm-hmm. Chef's
incredible.
kiss. Chef's kiss. Yes.
Yeah,
Yeah, I kind of think that this, yeah, make them think about their neighborhood. Like, what
mm,
you wanted in yours? I just threw that in there, kind of spice it up a little bit.
that's right.
Yes. Give them something to think about. All right, good stuff, y'all. Okay. So where are we with time? Okay, okay, we only got a few more minutes left. So let me slide on through. Okay, so you all pretty much have the gist of, based on the template that we provided, how to get started, as far as like the rubric, some areas where, you can highlight and improve in order to, tell your story and provide, a great capturing of why why this EPA rule should not be rolled back, right? And
Mhm.
so let's slide over to how to submit your comment, the step-by-step process with that, which is about 6 steps. And I already have the regulations.gov open. Let me see if it will pop up for me again. Okay. Can y'all see the regulations.gov? Or y'all
Yep.
see it? Okay,
Yes.
perfect. All right. And so this is the site that you would go to. And then you would search the docket for EPA dash HQ dash 2019. See if it's coming up for me. Okay, and here it is here. I'm gonna click search. Okay, and then we are gonna find the rule. So let's scroll. I'm sorry, y'all. I'm gonna put myself on mute, y'all.
Question. If you type in rule after, will that help? Will that work? Mm. Or maybe comment. Oh, well, they had our comment in the archive.
Now, I may have skipped a step. Let me go back to sharing my screen. Okay. So there's a lot of things that pop up here. Well, let's try to look for 2024. Try to search it again. Website. Hmm. Y'all, I may have missed a step since this is. Yeah, here we go. So we'll click here. Yeah, can y'all see my screen where I am at now?
Yep.
Yes.
Can y'all
Yes.
hear me? Okay, sorry. There we go. Okay, so when you go here, yeah, you want to click over here to your left-hand side and propose rule. I was like, I missed a step. That's the step I missed. And then the first thing that will pop up is the proposed rule here. And as you can see, it says open for comments, and it shows you when the comment period closes, which is 11:59 p.m. on May 1. So go here, click comments, and you can copy and paste or you can upload. And then if you want to opt in to receive confirmation, which I recommend, you can choose to identify as anonymous, and you'll receive that confirmation that your comment was submitted. And so here is where you do anonymous. If you don't want your name associated with your comment, individual. If you do want yourself or another person who represents you, you'll do the reCAPTCHA, and then you'll click submit. And you have officially submitted your comment. Easy peasy. And so we got 11 days until this comment period closes. All right. There we go. Okay, so before we get out of here, we just want to reiterate some tips for making sure that you have a strong comment. These are evidence-backed tips that will help your comment stand out in the federal record. So again, as you know, we shared, make sure to use your own words. You telling your story is much more stronger, and it carries more weight than a mass copy and paste ChatGPT statements. Be specific. Make sure that you are naming the provisions that you want to keep, and connect your issue to your community. So the local data, some of the resources, that we'll provide to you, personal stories, putting zip codes in there, all of that, tells the real person impact. Cite reputable sources, such as EPA data, peer-reviewed science, and health reports. Mention the vulnerable populations. So those people in community who are highly impacted, which are our children, pregnant people, elderly, and people already living with chronic illness. And then end with a clear ask. Ensure that you strongly urge EPA to withdraw this proposed rule. Some things that we want to avoid: making sure that we're not only submitting that we say that we oppose this, but the reasonings, why we oppose this. Don't use inflammatory or threatening language. Let's keep it diplomatic. Let's keep our story focused on the main thing. And don't worry about perfect grammar. Being clear and sincere in sharing your comment is what matters the most. And please, please, please don't miss the deadline. May 1st at that 11:59 is the hard cutoff. Once that time and that date hits, that's it. So, we have this week, we have next week in time to work on our comments, submit our comments, and, make sure that our voices are being heard. All right. So resources and next steps. So again, submit your comment before May 1st. We can provide some of these fact sheets to you all via email. The legal challenges, you can look at some of our partner groups such as Earth Justice, Union of Concerned Scientists, and the Southern Environmental Law Center. They are also challenging these rollbacks. The cancer risk near you. So EPA has an air tox screening tool, which you can put your zip code in to check to see the air toxicity in your community, and then get your comment reviewed. So you can submit your draft to info@younggiftedandgreen.org, and we will provide feedback to you via email for free 99. So, we'd love to help ensure that, you feel like you are submitting your strongest and most clear comment about this issue. So feel free to email us and we will respond back to you. All right. And your voice is your power, and let's make sure to use it before May 1st. And that is all that we have for this workshop. Keyshawn, do you have anything you want to add?
First, I just want to thank everybody for joining us at this time of the day. We got all the resources here ready for you. So please reach out if you need anything or any assistance with drafting your comment. The only thing I would add is tell somebody, tell one other person about what's going on and have them submit a public comment as well. Thank y'all.
Thank you all, and please be sure to follow us on social media at Young Gifted and Green, and follow MCAP on social media at Memphis CAP. Remember, clean air is not a privilege, it is our right, and we got to fight for it. Thank y'all.
Thank
And y'all,
you.
it's Memphis CAP_ORG. I'm gonna just put it in chat real quick. It's okay.
And
Or
are there any questions before we get out of here, you all?
No, thank you so much.
All right. Thank you, Josh. Thank you, Ashley. Thank you, Bridget.
thanks, y'all. Bye-bye.
Bye.